Well, everyone, to an in-depth look at optic disc drusen, a fascinating and sometimes challenging condition affecting the optic nerve. Join us as we unravel the complexities of this eye disorder, exploring its origins, effects, diagnosis, and management. The exact cause of optic disc drusen remains somewhat of a mystery. However, it's believed to stem from an accumulation of proteins and calcium salts within the optic nerve head. Genetics likely play a significant role, as the condition often runs in families. Essentially, the optic nerve, responsible for carrying visual information to the brain, becomes a site for these deposits, leading to the formation of drusen. Now, let's delve into the pathophysiology. These drusen, which are essentially buried deposits of protein and calcium, can disrupt the normal structure and function of the optic nerve. As they enlarge and increase in number, they can put pressure on the nerve fibers, potentially damaging them. This compression can lead to visual field defects and, in some cases, even affect central vision. The drusen can also cause small blood vessel abnormalities within the optic disc, further compromising the nerve's health. Estimating the precise prevalence of optic disc drusen is difficult, as many individuals remain asymptomatic and undiagnosed. Studies suggest it affects approximately 1 to 2% of the population. It's more commonly found in Caucasians and is often detected incidentally during routine eye exams. While it can occur at any age, it's more frequently identified in children and young adults. Many people with optic disc drusen have no noticeable symptoms, particularly in the early stages. However, as the condition progresses, individuals may experience gradual peripheral vision loss. This loss can be subtle and often goes unnoticed until significant damage has occurred. Other possible symptoms include transient visual obscurations, where vision momentarily dims or blurs, and rarely double vision or headache. In some cases, complications like choroidal neovascularization or blood vessel growth under the retina can cause sudden vision loss. Diagnosis typically involves a comprehensive eye exam. An ophthalmologist will carefully examine the optic disc using various techniques. Ophthalmoscopy, which involves looking directly at the back of the eye with a specialized instrument, can often reveal the presence of drusen. However, in some cases, especially when the drusen are deeply buried, additional imaging techniques are necessary. These include optical coherence tomography, or OCT, which provides a detailed cross-sectional image of the optic nerve, and fundus autofluorescence, which highlights the drusen due to their characteristic fluorescence. Visual field testing is also crucial to assess for any peripheral vision loss. While there isn't a formal classification system with specific types, optic disc drusen are often categorized based on their visibility. They can be classified as buried, where they are difficult to see on a regular exam, or superficial, where they are readily apparent. The depth and size of the drusen can influence the severity of visual field defects. Currently, there's no cure for optic disc drusen. Treatment focuses on managing any complications and monitoring for progression. Regular eye exams are essential to track the condition and detect any changes in vision. If complications like choroidal neovascularization develop, treatments like anti-VEGF injections may be necessary. In rare cases, where the drusen are causing significant pressure on the optic nerve, surgical intervention may be considered, but this is generally not recommended due to the risks involved. Unfortunately, there's no known way to prevent optic disc drusen from developing. Given the suspected genetic component, genetic counseling may be helpful for families with a history of the condition. However, early detection and regular monitoring are crucial for managing the potential complications and preserving vision. The prognosis for individuals with optic disc drusen varies. Many people experience little to no vision loss throughout their lives. However, a significant minority will develop progressive visual field defects. Early detection and careful monitoring are crucial for maximizing the chances of preserving vision. Recent research is focused on identifying biomarkers that can predict disease progression and developing new treatments to prevent optic nerve damage. Researchers are also exploring the potential role of genetics in understanding the underlying mechanisms of optic disc drusen. Ongoing studies are crucial to improving our understanding of this condition and developing more effective strategies for managing it.